This presentation focuses on Asian Americans, and more specifically Japanese Americans. Data and information specific to Japanese Americans was difficult to find. Some information may reflect Asian Americans in general and will be specified. Japanese culture and beliefs will also be discussed. The topics covered within this presentation will include background, beliefs, methods of healing, health status, health disparities, cultural challenges, and nursing's role. Japanese immigrants first arrived in the United States in the late 1880s due to poor conditions in the Japanese economy. By the 1960s, the Japanese American population within the United States had stabilized, primarily due to the improved socio-economic conditions within Japan. By the year 2000, the Japanese American population had become the smallest Asian group in the United States. Currently, Japanese Americans make up 10% of the Asian American population. Majority of Japanese Americans belong to third or later generations and are generally the most assimilated Asian group in the United States. Japanese Americans have the lowest immigrant concentration, higher socioeconomic status, and greater integration into main society. There are now approximately 20 million Asian Americans with roots in more than 20 countries in the East and Southeast Asia and India. 52.3% of Asian Americans in the United States have earned a bachelor's degree or higher, compared to only 34.2% of non-Hispanic whites. Asian Americans living in the United States fare better economically than the United States population as a whole and are less likely to live in poverty than other populations in the nation. However, despite these facts, they still have higher rates of being uninsured than non-Hispanic whites. These facts pertain to all Asian Americans and are not specific to Japanese Americans. Japanese culture may be different from Japanese Americans living within the United States. However, some traditions and cultural aspects may still be carried over after assimilation into American culture has taken place. Japanese cultural traditions were historically influenced by Zen Buddhism. Zen Buddhism incorporates mindful attention to body sensations, specifically breathing. These practices have been dwindling within Japan, and secularized practices are growing in Western culture. Traditional Japanese medicine, called Kampo medicine, consisted of herbal therapy. Today, doctors in Japan mostly use Western medicine or a combination of Western and Kampo medicine. Traditional Japanese practices also include acupuncture and moxibustion. Many Japanese doctors today find it most important to focus on Western medicine, and Kampo medicine is infrequently taught during education curriculums to doctors in their trainings. Japan has one of the world's highest life expectancy rates, coming in at 80 years for males and 87 years for females. Asian American women have the highest life expectancy, 85.8 years, of any other ethnic group in the United States. The infant mortality rate in Japan is 2.13 deaths per 1,000 live births. Self-rated health is a comprehensive health measure that can measure morbidity and mortality across socio-demographic groups. Self-rated health for Japanese Americans does not differ significantly from whites, which may be due to their high socioeconomic status. This includes both education and income status. Asian American youth have higher rates of depression and suicidal ideation when compared to non-Hispanic whites in the United States. Acculturated Asian Americans have higher rates of depression and suicidal thoughts than foreign-born Asian Americans. This is thought to be the result of greater societal stressors. Asian Americans are disproportionately affected by cancer. Cancer is the leading cause of death for Asian Americans, contrast to the leading cause of death in all other Americans, heart disease. Asian Americans also have nearly double the rates of diabetes when compared to non-Hispanic whites. Generational status plays a key role on assimilation status into Western culture and beliefs. First-generation Japanese Americans may still share beliefs that elders should be cared for at home and not placed in nursing homes. Second and third-generation Japanese Americans who have cared for parents at home in the past may not want to be a burden, having experienced home care for elders, and may be more open to the idea of nursing home care. Japanese are less likely to verbally express emotions when compared to Americans. Japanese diet consists of rice, miso soup, seaweeds, pickles, green and yellow vegetables, fish, green tea, and low intake of beef and pork. This diet has been associated with low mortality and disability rates. Assimilation to Western culture may make adherence to such a specific diet difficult, as Western society eats often for convenience and less often for health benefits. Assimilation into Western society may also be to blame for Asian Americans' increased rates of cancer, namely dietary changes, sedentary lifestyle, and body composition changes. Culturally sensitive care is one way that we as nurses can provide the best care for Japanese American patients. For example, culturally sensitive mental health interventions geared towards Asian American youth is important to address the higher risk of depression and suicidal ideation this population faces. Cancer screening is another important step to combat this population's disproportionate rate of cancer. Asian Americans are screened for cancers at lower rates than Americans are. Diabetes screening and education is important to the proper diagnosis and maintenance of diabetes. Encouraging self-advocacy can also improve provider-to-patient relationships and improve patient outcomes.